So hyperkalemia, which refers to elevated blood potassium, which is potentially life-threatening because if it's extremely high, it can cause heart arrhythmias and actually eventually sudden cardiac arrest. So this is particularly a concern in patients with chronic kidney disease because they're not able to regulate their potassium and other electrolyte levels in the blood. And it's a significant public health concern because there are 37 million individuals living with chronic kidney disease in the United States. And about 500,000 of these kidney patients have end-stage kidney failure and are living on dialysis. And they are at particularly high risk of hyperkalemia, which is also related to their high cardiovascular mortality and morbidity. It's estimated that 20 to 25% of deaths in our dialysis population are from sudden cardiac arrest, and hyperkalemia probably contributes to a number of these mortality events. In addition, because of important drugs that are used in heart failure and kidney disease and diabetes to prevent cardiovascular events, some of these medications can raise blood potassium. And there's about 6.5 million people with heart failure living in the US. So having kidney disease or being on medications that are good for your heart but can raise potassium, it's pretty clear hyperkalemia can be a pretty big problem. And if someone goes to the hospital with high potassium, it's estimated that it prolongs the length of their hospital stay, and it costs their healthcare system about $25,000 a year whenever a chronic kidney disease patient has high blood potassium. So one of the big challenges with monitoring blood potassium and detecting hyperkalemia in a timely fashion in our patients is currently the only way to do so is for them to go get a blood draw. So get a blood test at their outpatient lab or at their dialysis center. If you get a blood draw at the dialysis center, we often don't get the lab results until a day or two later. And by that point, they could be running into serious, cardiac arrhythmia issues. So this AccurKardia AccurGuard device is using standard kind of electrocardiogram ECG data. They're specifically trying to pull lead 1 data, but using a simple, everyday wearable device that people already use, such as smartwatches. So if this device that you're wearing on your wrist can pick up lead 1 ECG data, and they have developed a technology that can alert the individual if blood potassium is trending high, then they in turn can contact their healthcare provider, say, hey, what should I do with this? Or potentially the healthcare provider could have given them a game plan on how to react to an alert from their smartwatch, and get treatment for the hyperkalemia before it spirals out of control and causes significant heart issues. So this would really facilitate timely diagnosis and an action plan rather than people waiting to get a blood test result. And sometimes, a lot of the times, this high potassium is asymptomatic. So having a objective output from this device that's reading electrical signals from the heart is a big potential game changer. So one of the cornerstones of goal-directed medical therapy for heart failure patients is renin-angiotensin blocker medications. So ACE inhibitors, angiotensin receptor blockers, or mineralocorticoid receptor blockers, And these medications, because of their downstream effect of blocking aldosterone, increases the risk of hyperkalemia. And historically, we didn't have easily available medications to lower blood potassium. So we would be telling patients, oh, we got to cut the dose of your renin-angiotensin blocker medication, or we have to stop it completely. And there's plenty of data that if you stop these medications, there's a higher cardiovascular mortality risk because they're so protective for heart health. So if there is an agent, technology that comes on the market to detect hyperkalemia, and in the past just 5-10 years, we actually have had a couple of new oral potassium lowering medications that came on the market, FDA approved. So ideally, we can use AccurKardia, to manage high potassium, give patients these potassium lowering medications they can take at home. And that would prevent them from having to stop their very beneficial, renin-angiotensin blockers and keep them on these medications that reduce cardiovascular events. And then in terms of this AccurKardia device coming potentially onto the market, I would say realistically at least a few months or maybe a year, because they still need to do prospective validation. So their algorithms have been developed using an extensive retrospective cohort of 20,000 patients, but you have to validate that it's going to work in a real-time fashion. So I know they're planning to set up a prospective observational trial where you're going to real-time correlate what the smartwatch is picking up with an actual blood potassium level that will have to be done through a blood draw. And then they still have to show proof that picking up these signals is actually meaningfully changing patient outcomes, which will require a randomized trial to compare folks who are being monitored versus folks who are not. And hopefully the folks that are getting monitored with this device and are getting effective, treatment for hyperkalemia will be down the road experiencing less cardiovascular events, less hospital visits. And that would then be very compelling to launch that into clinical use. So the big advantage with AI is the ability to process large amounts of data from thousands of patients, which would not be feasible if a human was having to manually go through and extract data points. So fortunately at University of California, Irvine, we actually have a center. It's a Center for Artificial Intelligence in Diagnostic Medicine. So their acronym is CAIDM, that has been working on integrating AI to improve, diagnostic tools. So a couple of projects that I am involved with in the kidney space with the CAIDM program at UCI. One is looking at CT images from patients and using that to try and predict degree of fibrosis or scarring in their kidneys, which is an important prognosticator of chronic kidney disease. And then another project is in collaboration with CAIDM and a neurologist to look at thousands of brain scans and evaluate risk of bleeding and vascular calcium in the brain in our chronic kidney disease population, which then predicts risk of future stroke. And then I've definitely seen work that's ongoing in other institutions that's taking tissue histology slides and using AI to really extract very granular information from histology slides to diagnose rare kidney diseases and to stage the risk of progressive kidney failure. So yeah, there's a lot in the kidney space. I should also mention our urology colleagues here are trying to use AI to automate detection of kidney tumors, kidney stones. So it's definitely a powerful tool that needs to be really developed and utilized with healthcare.